Good morning, everyone. I am Pam Myers with Pam Myers Social Media, and we are here with 3Q, New Mexico's premier business podcast.
And I'm Erica Yoakum. You forgot me. I'm Erica Yoakum. I'm your personal assistant. Oh my God.
Okay, we need to practice. It's all good. Yes, and so we are here. Our guest today is Anthony DeVontenno, and he's the executive director of Dental Care in Your Home. They provide palliative and preventative and limited corrective services for people that are homebound, which I think is a brilliant idea. Welcome. Thanks for joining us this morning, Anthony.
Thank you for having me.
I got to ask, did you start this business pre or post pandemic?
Well, so I didn't start the business, but it was started back in 2010, so pre-pandemic.
Wow.
So y'all must have just hit a banana peel on ice when everything hit, because then you can't go into people's homes and all that kind of stuff, and yet you came out the other side. So good job for that. Good job on that. This is going into people's homes is okay. First off, dental care, most people, and then you come into their home. But actually, that might be better. I mean, right? Because you're going to be less stressed out. Anyway, that's a brilliant idea. It is a brilliant idea.
Yes, yeah. People are who loves going to the dentist.
Right.
But who loves the dentist coming to you in the comfort of your own home? So,
Right.
Whatever apprehensions that a person may have, being in the comfort of your own home actually reduces a lot of that anxiety.
Yeah.
And so we're actually able to deliver better care when people are comfortable in their environment.
Right.
So what kind of, I mean, obviously you're not bringing in x-ray equipment and big old drills and things like that, right? Or are you?
Well, actually we are. So we actually have portable x-ray equipment called Nomads. They're handheld. So we're actually able to carry those into a person's home. And then we have the x-ray software on our computers to make it all work. And then we have portable equipment. I mean, some of it's pretty heavy. Some of it weighs up to 70 pounds. But we're able to get it to a person's home and give them the care that they need.
Wow.
Okay, Today I learned there's portable equipment, dental equipment you can bring into a home.
Yeah.
Wow.
Really? How wonderful for people that are homebound. I mean, even if you're not homebound, it's a great service.
Yes, it's an outstanding service. Just because, especially now, a lot of our new patients haven't had dental care since pre-pandemic.
Right.
So we were forced to shut down in March of 2020. But there were some patients that hadn't had care for a year or two prior to that. And with us getting to them now, it's been that long.
Right.
Wow. So, and even our established patients, they went some time without the appropriate dental care that they need. So, and given some just the challenges, we have patients that are autistic. We have patients that have Alzheimer's. So there's just various obstacles that a lot of brick and mortar dental practices aren't equipped to face.
Right.
Dental care in your home is where our clinicians get that training to deal with those different types of patients with those different needs.
Wow.
And having to go into their home, it's probably more stressful for us than it is the patient.
Because I'm laughing, I'm thinking I have a 125-pound dog who would need to know everything you are doing, and not and getting them. And Pam has even bigger dogs, so which your girls would be like all over that. I mean, right? Because they're dogs, they want to know. But
right.
Yeah, so you have to adapt to each home you walk into. So every time you go, it's a different situation you're walking into.
Absolutely. And actually, that's one of the things that our clinicians actually enjoy, because our clinicians, I mean, they're outstanding. I can't speak enough about our clinical staff. Like the entire staff is awesome, but our clinicians, they just have a heart for the work, and they're just so awesome with our patients in their home. Some of our clinicians don't like dogs. So, sometimes, if we have a 6-patient day and it happens to be that day, all 6 patients have dogs. So
the universe is going to do that at least once, right?
Exactly. Right. Yeah.
It's how everything's going to, I mean, Mercury in retrograde and everybody has dogs,
Absolutely. So what is the service area, Anthony? Do you go all over this area of New Mexico, or?
So right now we service Bernalillo, Sandoval, Torrance, Valencia County. Here in the next month, we're going to be expanding our services to Santa Fe County, Socorro County, and San Miguel County.
Wow.
That's tremendous.
Obviously, there's a call for what you're doing, because I mean, I've never heard of this. It's like one of those things you wouldn't think could come to your house, right? Like,
right. And that's the thing, that with our client load, there's mobile physicians, that go and see patients in their home and care facilities. The 2 greatest needs, dentistry and podiatry. So, dentistry, it affects so many, the dental aspect affects so many aspects of a person's health. The same plaque that builds up in your teeth is the same plaque that builds up in your heart. And so when you're in that closed system in your head, the plaque is so much closer to your brain and everything. So it's absolutely very important to get that care, considering that the mouth is also one of the richest blood supplies in your entire body. So it's absolutely important to get that dental care.
Wow.
Jimmy Smits taught me that on NYPD Blue. Bobby died of a heart attack because he had an abscessed tooth and it trashed his heart. And I remember watching that and going, that can happen. Yeah, that can happen. That's a real thing. So made me a religious toothbrusher after seeing that. So wow, that's it. And I would imagine that I'm still trying to wrap my brain around a dentist showing up at your front door and like, you have to, do you sit at your kitchen table or like, go sit in your recliner? What do you do? My recliner goes all the way back.
Well, absolutely. Wherever the patient's most comfortable. We see them in their bed, their recliner, at the kitchen table. And it just depends on the procedure. Like our dentist, Dr. Fritz, if she's doing an extraction on a particular day, she likes to have the patient recline as much as possible. So actually being in a recliner is great. Or if they're in their bed and they have an adjustable bed where the head tilts back and forth, that's great. But wherever the patient's most comfortable, and that's where we do the work.
Wow. Are there procedures you cannot? I'm sure there. What procedures?
So one of the procedures that we don't do is a root canal.
Okay.
But that's a general dental.
Bummer.
A general dentist can do a root canal, but we choose not to because of the specialized equipment. It takes so much more equipment, and it's going to be better off going to an endodontist to do that work. So we'll normally refer that out. But what our goal is to do the preventative care so that a patient doesn't need a root canal.
Yeah.
Right. Yes. Yeah. And do you accept regular insurance?
Yeah, so we do accept most insurances. Most of our patients are Medicaid patients, which that's a special circumstance in itself. But we accept insurances like Delta Dental, Cigna, United Healthcare. We accept over like 89 insurances. So,
oh wow, wow.
How did you get involved in this company?
Good question.
Well,
do you have a background in dentistry or?
Absolutely not. So actually, my father, he was a Vietnam vet, and a 20-year Army veteran, and so he would never wear his dentures, and so like every patient that wears dentures, they don't wear them because they don't fit properly.
Oh yeah.
So I called the VA, and it was going to take about 6 weeks to get him in there. He didn't want to wait that long, and I actually live 30 minutes south of Albuquerque, and he was homebound. So I was actually able to get in touch with Dental Care in Your Home. I called on a Thursday, and then the following Tuesday, Dental Care in Your Home showed up, and they were able to adjust his dentures, and he wore them just fine right after that. So after that, I was able to be a sponsor for some of the fundraisers, and I wanted to help other people. So I was actually a board member from November 2017 until November of 2021. And then I became a part of the day-to-day November of 2021 till now.
Yeah, congrats.
Well, thank you. But no dental background at all. But this organization has taught me everything that I know about dentistry.
Yeah. Wow. And you're invested in it with your heart, which is
yeah,
right. So cool.
Absolutely. Because when Dental Care in Your Home came to help my father, it was such a great relief because he was on oxygen. He needed a walker. So to get him up, get him showered, get him dressed, and then get him in the vehicle, that was a job in itself. Then to get him to the hospital, then to get him to the appointment, like that was an all-day thing.
Right.
So that sense of relief that I had, not having to take him to the dentist, I want to share that with everybody, everybody else that needs it as a caregiver. And so it's very nice. Like it's very rewarding to hear caregivers on the phone when they're like, "Oh my gosh, thank you so very much," and even the patients when we're there to be like, "Oh my gosh, thank you so very much," where they might have an abscess tooth, and Dr. Fritz is able to, we call it the tooth snatcher, but when she takes out a tooth, the relief that patients have immediately after that, that's just so rewarding in itself. And that's what continues to fuel my passion for the organization.
That's amazing.
Yeah.
That's amazing. And that you made, like I said, and that you guys made it through out the other side of the whole pandemic. Because, I mean, your business model was very susceptible to being shut down, right? So, though, I mean, we're doctors. I'm not clear on this. We're doctors and dentists and things. You guys were like necessary, right? Were you considered necessary so you didn't have to completely shut down, or?
So we were during the pandemic, we were considered necessary, but a lot of the care facilities deemed us as unnecessary.
Wow.
Right. So we were limited to emergency care only. And seeing patients in their homes. But at that particular point, it was just, there was a demand, but there wasn't enough of a demand for us to be open on a regular basis. And so we made it through.
Good job.
We made it through.
Good job. Yeah, wow. I'm very impressed and completely blown away that this actually happens in your home. Then you hear about it and you go, well, I mean, why not? Why couldn't? Because everything has gotten so much smaller, right?
Absolutely.
Everything has and more powerful. I mean, my phone alone is 1,000 times more powerful than my first desktop computer. So it makes sense but I would never, it wouldn't even have crossed my mind until I saw your business and I was like, oh, what?
Yeah, right. And so if somebody wants to make an appointment, is there a wait list or what is it?
Depending on what it is that they need. So right now for hygiene, there is a little bit of a wait. Because right now we're scheduled about 6 weeks out. And we have over 2,000 patients right now.
What? I'm so, wow.
Yes. And then, so if it's emergent care, we try to get there as quickly as possible because we don't want an abscessed tooth.
Right.
We don't want a Jimmy Smith situation.
Yeah, right.
We try to get there as quickly as possible on an emergency situation. But yeah, there is a little bit of a wait list for hygiene until we can get some more clinicians in right now.
Okay.
Well, yeah, because you can't just hire a regular clinician. You got to hire somebody who's willing to go into people's homes. That's like a whole next level stuff. That's cool. But, again, dogs. So they got to be willing to that. And I'm sure you get your choice of helpful helpers. You want to stand there because I would be. Well, no, I wouldn't. That's a lie. I would be gone because as soon as I would hear the zzz, I'd be. But I'm sure you get lots of helpful. If you held it like that, it would go. So you got to have a whole nother level of care. Wanting to care to go into people's homes and then do this. This is like brilliant. Wow. I'm so glad.
And the wide range of patients that we see dealing with a patient that's on the spectrum is completely different than dealing with a patient that's that has Alzheimer's.
Right.
So we can see a patient like we've seen a patient where she knew she had Alzheimer's and she was like, I probably won't remember you, but she let us do the work. And when we saw her 6 months later, she had no idea who we were.
Right.
But she told us the same story.
Right.
But then you just have people that are just ornery and they're like, hey, I'm 86-year-old and
Exactly. Well, you know what? Thank you for not driving is what I would say. That's gonna be me. Hey, I'm telling you, when I discovered groceries could be delivered at my front door, that was the bomb for me. I was like, what? Yeah. So now I know I can have my dentist show up at my front door, and you come to Valencia County.
Right.
It sounds like you live in Valencia County, so that I'm down here too. I'm in Los Lunas, so the roads, it's like half mud. So you've got all that. This is really fascinating. I have like a million questions and not enough time, but so I'm going to put up your website here. You can. This is right. Did I get this right? DentalCareInYourHome.org.
Absolutely.
Folks can go there and find the information and check you out, and it's a nice, clean little website. Go get the information that they need. Can you book an appointment from that website?
So actually, you can fill out a new patient form on the website. And then from there, we'll give you a call and set the appointment.
Awesome.
Fantastic.
Yeah.
Wow.
Yeah. Anthony, thank you so much for being a guest. We love what you are doing. It's such a great service for so many.
Well, thank you so very much for having me. It was a pleasure being on.
Yeah. Thanks, everybody, for listening. I am Pam Myers.
I'm Erica Yoakum.
And if you have a business that you would like to be showcased on 3Q, New Mexico's premier business podcast, just let us know. Thanks so much for listening.
See you next week.